Hey, I'm Brandon, founder of the TRT community, host of All Things Testosterone. Today, I'm here with Dr. Jeff Nuziard. He's the CEO of Sexual Wellness Centers of Texas. Rather than go into a full blown introduction, I want to throw it to you. So I'll say you had erectile dysfunction at the age of 40. And
40 years old.
that's what started all of this before you were touring professionally as a musician.
Well, that was many years ago.
Okay.
That was like 100 years
Yeah.
ago.
Yeah.
And then 50 years ago, I had the ED problem. So,
So
yeah,
what you had the ED problem, and where'd you go from there?
in my closet and cried and sucked my thumb and was like, now what do I do? People don't understand when a man gets erectile dysfunction, the emotional
Yeah.
gamut that you run through is absolutely horrific. And a lot of women don't understand it. And look, they don't need to understand it, but the way we're wired, we care about that.
Mm-hmm.
And when you don't have a working penis, you just, for me and for patients I see every day, you want to turn in your man card and call it a day. Like I'm not even a man.
It's almost like what is left for you at that point. And even beyond the erection, you've got days where you're just hanging naturally a little bit more impressively than other days.
Right.
And on those days, you feel more like a man.
You feel more like a man. You feel like, hey, I got a pep in my step.
Yeah.
People don't know you got something else going on, but it's all right. It's just part of what fuels the male persona.
Yeah.
And I'm not saying, I mean, we're not that shallow. Men are more than their penis, but that's a big deal.
Mm-hmm.
Take it away, and you've got a problem on your hands as far as being a male is concerned. So, at 40 years old, I was like a lot of sexual thoughts, a lot of sexual desires, a lot of drive, no performance.
Yeah.
And it's humiliating, embarrassing. Don't want to talk about it. Don't know where to go for help. Only thing people have to offer is pills,
Mm-hmm.
or some kind of BS potion and lotion and
Yeah.
whatever. It's not like that.
So you oversee the center. Are you a medical doctor, medical
No,
director? No.
no, no. My story is crazy. I was a certified financial planner
Okay.
for many, many years, and then when the Dodd-Frank bill went through, um, I literally would go to work every day wondering if I'm breaking the law or not. It was so convoluted.
Mm-hmm.
Stress level went through the roof. I'm sure that had something to do with the ED as well. I go through a divorce. I'm going through ED. I'm like, okay, it's time out. And I sold my book of business and sat there feeling sorry for myself. I said, well, I can either. One of my favorite lines ever in a movie, and it's driven me most of my life since I saw the movie Shawshank Redemption. He said, get busy living or get busy dying.
Yeah.
And that was my choice. I'm either going to cry about this or I'm going to figure it out. And I raised my kids, and my wife will tell you all the time how I just look at her and say, baby, figure it out. I mean, you just got to figure it out.
Mm-hmm.
No one's going to teach you how to. So it wasn't like I could go back to school to learn how to fix ED. If they taught it in school, it would have been fixed a long time ago.
Yeah. What year was this? Age yourself. Go ahead.
Well, I'm 59. I don't care about aging myself, so I'd have to say it was 95.
Okay. So before you could pick up your cell phone and,
I guess
join
2005. Yeah, my math is
still
bad.
probably
2005.
before you could pick up your cell phone and join a Facebook group and get answers. Like,
Right, absolutely. I mean, well, cell phones, yeah, but we were back then in 2005. You wanted the smallest one you could find,
right.
and now,
Yeah.
right? You remember the little?
Yep.
If I found one that was itty bitty, it would fit in my pocket. It was all good. But and they weren't the wealth of information they are today. And again, all that you ever heard of in 2005 was Cialis and Viagra. I mean, that's all there was.
Yeah.
So it was 2006. I went through the divorce, went through everything. So I'm 41 now. Was struggling that last year and just not sure what to do. So I did what everybody else did. I went, had a friend as a doctor, and he hooked me up and did the Cialis for a while so I could hide in it.
Mm-hmm.
Knowing I had a problem, but if I just took that pill, I'd be all right. And then going through that next year was pretty tough, divorce and all that stuff. So I'm like, this is getting worse and worse and worse. I got to figure this out. Had money, had time, and I said, you know what, let's go. And so I dove into research on my own, and had a lot of friends that were doctors that used to be clients. And so I would just go talk with them. And this is what I'm thinking. This is what I'm reading. This is what I'm finding out. And I got my hands on every white paper I could get my hands on. And there's a lot of information out there around ED and been a lot of studies on ED, but they were all dancing around the problem and everybody was talking about it, but not connecting the dots.
Yeah.
And so the more papers I got, the more I started seeing the common denominator through this. And I go, wait a minute, I think I got this figured out already. And I had a pretty good laser background, extensive laser background. It was more of a hobby thing. And actually,
Where'd that come from?
just I was always interested as a kid, on watching TV, shooting somebody with a laser gun and they blow up. And
Yeah.
but now I hear they're doing lasers to restore eyesight, and they're using lasers for all kinds of surgeries. I'm like, so it was just a hobby, curiosity hobby, kind of a nerd side of me. It's like, this is really cool.
Yeah.
And I more started learning about it, the more I started really loving lasers. And then I got a job with big laser company that I had known about and read about, but they were out of the country. And they became an American company, and I was actually the first one they hired when they became an American company here in the States. Thank God I did. It ended up being a not so good situation when I left, but had it not been for me in that company, I wouldn't have been able to connect all the dots and figure this out.
Yeah.
And so being with them, I was able. They have technology that's the only laser in the world that'll do it, that allows you to get heat deep into any tissue you're wanting to get into without hurting the top layer, without hurting the epidermis at all, having any issues. So back and forth with my doctor friends, doing more laser research, reading more papers. I was able to figure out a 4-pillared protocol that literally reverses and cures erectile dysfunction. I was my first patient, obviously, and tried everything in the world on me first out of experiment, and won't admit or deny that I might have burnt myself several times and did a lot of damage that, that's science, right? You got to try it.
Yeah.
And then I had some gullible friends that would go along with it and say, sure, let's try. And I had some guys I actually had to pay to do some more aggressive things, and they were good as long as they got a paycheck. They were fine with it. So I spent a ton of money doing all this stuff.
Yeah.
And was able to come up with just, again, this protocol. And with these doctors and going through all this stuff and then presenting my argument, my thesis, my argument, showing the proof of a 250 person clinical study, I was awarded a PhD in biomedical science.
Really?
Yeah.
Wow. What is that machine called? What's the laser called?
The laser? Well, I can't really talk about that. What the laser is, because the company will come after me.
Okay.
They're already mad at me.
So in your office, if a patient is being treated, you mentioned 4 pillars.
Yes.
Are we talking like laser, shockwave, etc., or
laser, shockwave, hormone optimization? And then I was able to come up with a fluid that we have trademarked and is part of the patent. It's called tissue regenerative fluid. It's pretty powerful stuff. Back in the day, a guy named Dr. Reynolds out of Fairhope, Alabama, invented the P shot and the O shot.
Yeah.
Okay. That's done with PRP. That's done with drawing your blood, spinning it, injecting the platelet-rich plasma back into your body. Back then it's all we knew, and it was good. It works especially well for a guy 30 years old, got a torn rotator cuff. How about we just do PRP injections around that? It's very regenerative, and good for you and good results. But try that with a 65-year-old man, 70-year-old person.
You're starting with less quality.
Very bad quality. You're talking 60, 70-year-old exosomes or stem cells, that are in the PRP. So that wasn't, not only that, it was most physicians today, med spas, whatever out there, they don't really sell it right anyway. If you go back and read the original protocol from Dr. Reynolds, it's 3 shots, 2 weeks apart. And it's not just a shot. In the penis, there's 5 injection sites. 1 on each side base, 1 on each side mid shaft, and then 1 actually in the glands, in the ridge of the glands. That's the only one that was painful. The other two are not. You don't even feel it. I mean, people, it's a big mind game to go, you're sticking a needle in what?
Yeah.
People don't understand there's no nerves inside the shaft of the corpus. You get past the skin, there's nothing there, right? So you don't feel the shots. But the problem, what you do feel is 5.5 ml of volume
Mm-hmm.
that you're injecting. That's a lot of volume. So
Yeah.
the pressure. And then women, it was like 1.5 ml in the clitoris. That's a lot of volume of fluid.
And there are nerves there, right? You
And
feel
there are
that.
nerves in there.
Yeah.
But you're feeling the pressure
Yeah.
of the fluid, you know? So I said, there's got to be a better way. And at that point, this was like 25, 30 years old, you know, technology, the PRP stuff.
Mm-hmm.
So in researching that, you know, I find that there's two layers of the placenta. There's the chorion layer and the amnion layer. The chorion layer of the placenta, the stem cells that come from that are very generative, if that's a word, in the making of the baby. That's actually where the baby's made.
Mm-hmm.
Okay. The amnion layer is more, for lack of explanation, more of like the health and well-being support system. Okay. So all the good stuff is in the chorion layer. And the amnion layer is good to have as well, but it's just not as potent or powerful or regenerative. So there's a lot of people out there selling amniotic fluid saying this is better than PRP. Yeah, it probably is, but it's not as regenerative if it's made out of the chorion layer.
Yeah.
So after studying all that, I'm like, okay, so we do 50 billion from the chorion layer. I put that in amniotic fluid as the carrier, and then infuse it with type 1, type 3 collagen, infuse it with some other highly concentrated growth, beta growth factors. You have an amazing cocktail that we have zero side effects from, nothing but great regeneration. There's a couple pulmonologists right now that are testing this for lung regeneration and for COPD patients, and it's working.
Yeah. Do you still have to inject that into the base, the mid shaft, and the glands?
No, it's half an ml on mid shaft left and half ml mid shaft right. Done.
Nice.
Yeah, and so the volume is very low, and again, no pain. A lot of patients come in and say, "Just tell me before you do the shot." We already did it. Oh, I didn't feel it. Okay, great. So it's very regenerative. So doing those four things are the main four components.
Yeah.
But then it's understanding how the body works and the timing factor of the collagen and how your body remodels collagen.
Mm-hmm.
So for decades, everybody says ED is from blood flow. False statement. That's not accurate. Blood flow is a result from erectile dysfunction.
Okay.
It's not the cause of erectile dysfunction. But if you put 10 urologists in here, they would all say, no, it's blood flow. You're wrong. Okay, well, I proved all that wrong.
Yeah.
So the best analogy that I can give you to understand this, and it will make total sense, is think of your body like your electrical panel at home. Okay? Everybody knows their electrical panel. You've blown a breaker here and there, you've had to fix it.
Yeah.
So when your testosterone, in our 20s, we stop producing testosterone by about 2% a year. Now, for me, I was totally different. At 27, I know my testosterone was 1185. When I was 40, it was 305.
Yeah.
So I dropped very fast and way more than 2% a year.
Yeah.
Everybody's different. On average, the human body, male or female, we stop producing testosterone by about 2% a year. All right. So just for easy math, let's say 25 is your start date, and now you're 65. Okay. And you're having ED issues. Well, number one, those ED issues didn't start at 65. They started before that.
Yeah.
So you got 40 years, 80% of your testosterone production on average is gone. So back to the analogy of the electrical panel. When your testosterone's coming down and it hits a magical number, whatever is unique for you, it opens the door to that panel and it starts turning breakers off one at a time.
Mm-hmm.
That's the aging process. So point number one, Western medicine says we age and lose testosterone as we age. False. We lose testosterone anyway. And when it hits that number, that activates the aging process and puts it on a schedule.
Yeah.
Okay. It's tied to your telomere of your DNA. So The first breaker that gets turned off is the production of collagen. Very first thing. And that's what starts the aging of the skin, aging of internal organs, because collagen is a protein in our body that's of unbelievable importance for the integrity of the tissues, of the muscles, of everything. Okay.
Mhm.
So women see it first because they care, and men don't. But women see it, they got all of a sudden a line. Oh my God. Now they got a line on their lips. Oh, I didn't have that a week ago.
Yeah.
And it's not because they're bad or did something wrong or laid out in the sun, although that could have had something to do with it, but they're depleting collagen. If you're not regenerating new collagen, you're using up, and your collagen is aging and degenerating.
Mhm.
Problem is, inside the penis are two tubes called the corpus cavernosum. They're two spongy tubes. Blood flows in, that sponge absorbs all the blood until it gets hard enough and it activates a muscle. I always tell people it's kind of like a gate valve, right? Where it locks the blood in until you have orgasm. It opens up, the muscles flex and push the blood back out. All right. As quickly, however quick you can relax is how quick you can recover and get back in the game again. It's not about flexing, it's the other way around.
Yeah.
So the problem is the first symptom of erectile dysfunction is I can get erect but not keep it erect.
Mhm.
So that's the issue. The sponge is held together by collagen. When that collagen degenerates, that sponge is like the kitchen sponge at home. You use that long enough, it shrinks up in size,
Mhm.
doesn't absorb anymore, and you throw it away. Well, we can't throw this away, right? But it's still doing the same thing. The collagen is degenerating, so the sponge is shrinking. Number one question I get out of every patient is this going to make me bigger? Yes and no.
Yeah.
Yes, it will make you bigger than you are today.
Yeah.
It will not make you bigger than you once were. Because the reason you feel, and everyone says, I've lost size. Yes, you have. That sponge is degenerating.
Mhm.
Makes sense, right? So if you're not able to absorb all the blood to get hard enough to lock that down, that's called the venous leak. That's the first symptom of erectile dysfunction. That's the very beginning of it. From there, it snowballs downhill.
Yeah.
Our bodies overcompensate for injuries or things that are not working in our body. That's how our bodies are designed. So the veins, more or less, say you're not absorbing the blood that we're sending in, so they get atrophy and start shrinking up. To send less blood in, so maybe you absorb that. You don't absorb that, so they shrink up more. So then it goes from I can get erection but not keep it erect to I get about a 75% erection, a 50%. And it snowballs to where I get nothing. Okay. And it's all started with your testosterone hitting a level, your collagen starting to go bad, and that sponge is bad. So what do we got to do? We got to recreate new blood vessels. You have to remodel and thicken the collagen in the sponge. And you have to recreate at the cellular level new spongy tissue.
Yeah.
We can do all that. But if we don't get your hormones optimal and get your testosterone back where it's supposed to be, not what the medical books say, it's just going to do the same thing.
Yeah.
To prove this point, I can't tell you how many patients come in and say, I was doing great on Cialis and Viagra for the last 5 years, and now those pills don't work. I doubled the dose. They still don't work. It's not that those pills don't work. They do work. They dilate vascularity. They just don't fix the problem.
Mhm.
The problem is the sponge. So they dilate vascularity. You're still not absorbing it. It's just sending a bunch more blood in.
Yeah.
And I ask those guys all the time, I say, hey, so when you take those pills now, you say you can't get an erection. Any changes at all? Yeah, I get a little bit firmer because they work. You're getting more blood in, but nothing to absorb it. So the blood's flowing right back out.
Mhm.
You got to repair the sponge. Then the blood flow, you got to repair that too.
So, which portion of your pillars is responsible for what? The shockwave helps with this.
So the shockwave and the laser, great question. The shockwave and the laser kind of work hand in hand. Okay. The shockwave has been proven over and over again by many physicians, a lot of research on it. It creates micro tears in the tissue. I liken that to lifting weights.
Mm-hmm.
Okay. You tear your muscle down, your body at the cellular level rebuilds those muscles. The older you get, the longer it takes to recover because we don't have good stem cells. Our stem cells are older. We don't have near the amount of them. That's the second breaker that gets turned off.
Mm-hmm.
Stem cell production. So recovery takes longer and things like that. So the shockwave puts micro tears in the tissue. Shockwave by itself, you're 60%. Now, Gainswave or Z Wave or any of these companies will tell you, oh no, we get 60, 80, 68%, 75%. It's all BS. It's all paid for. Those are bought and paid for studies.
Yeah.
The real study is 60 to 62% tops, and 62% if you're younger.
Mm-hmm.
55 to 60% for the 55 to 70-year-old guy, right? Again, because your stem cells are lower in quality.
Is this 55 to 60% of patients see benefit, or does the average patient see 55% benefit?
No, they see benefit. 55 to 60% see a benefit.
Yeah.
So they have the 40% problem, right? You get 40% pay for it and they're pissed off because they didn't get any results.
Well, and even if they're in the 50 that receive the benefit, how much benefit are we talking?
They're not getting full benefit because it doesn't fix the sponge. Yeah. And that's my point, right? So, and thank you for pulling that out. But you see, so we're creating new veins. It's proven to create angiogenesis, new vein structures, okay? And so it's creating new veins. So now we're getting good blood flow back in, but we didn't fix the original problem. The other thing it does do is it puts micro tears. If you do it long enough, the Gainswave protocol isn't accurate enough. It's not done right to where you can get the micro tears in the sponge. You can get them on the outside of the corpus on the smooth muscle cells, but not on the inside where the sponge is. You need to be able to tear that as well so that your body will create new spongy tissue.
Yeah.
Then we have to remodel the collagen. Only way you can do remodeling of collagen is two ways. When you injure your body, whether it's through a mechanical injury, you cut yourself, your body will produce collagen to fix that cut, and elastin. So a mechanical injury is anything that breaks, okay? Then there's what's called a thermal injury that people don't even hardly know anything about. The only thing that'll do that is a laser. And you have to get the temperature hot enough to create the thermal injury. So this laser will get everything hot inside. On the outside, it feels like a heating pad. Mm-hmm. On the inside, it's pretty hot. It's 45 Celsius, so 130-ish Fahrenheit. You don't feel that, but it's hot enough to remodel that collagen and thicken all that back up. So while you're using shockwave to generate, using heat on a non-invasive way to deliver that heat so there's no injury on the outside, you're remodeling collagen on the tissue with all new cells, both muscle cells and sponge cells.
Yeah.
So those together, and angiogenesis creating the veins. So all those together work to rebuild. Getting your hormones optimized once the aging process starts, you can't stop it, but it will slow it down to where it won't allow that new tissue to degenerate as fast as it was.
Yeah.
And then using the tissue regenerative fluid puts all this on a fast track. It's like back in your 20s when you could work 8 hours, go work out at the gym for 2 hours, go party with your friends all night and get up and do it again the next day.
Yeah.
You recovered quickly.
And have a belly slapping hard on when you did it.
Exactly right. 100% right. Because you recovered quickly. Everything was working.
Yeah.
So that's how all this works in a nutshell, and that's how it goes together.
So studies show that this is 97% accurate or
to be
effective.
Exact, 97.2%.
What does that mean? 97.2% of patients see a benefit?
Great question. We set up our parameters. An erection that's penetrable and sustainable till orgasm when you want the orgasm.
Okay.
All right. Because one of the other things that happens with ED is nerve degeneration. And it starts being like you take a spark plug wire off the number 1 plug and put it on the number 4 plug. Mm-hmm. You're going to have misfiring, right? So there's two things that can happen. You lose sensitivity because your nerves just degenerate, or they misfire and you have premature ejaculation. Too much sensitivity.
Yeah.
So all this it's one or the other. And so you can have an orgasm too quick or just not have one.
What did you say causes that misfiring?
It's the degeneration,
desensitivity. So degeneration.
Degeneration of the corpus cavernosum, which is the vessels as well as the sponge.
Yeah.
So when those blood vessels, you're not getting enough blood flow to feed all those. So
Mm-hmm.
you start getting nerve degeneration at that point.
Okay. And does that require? I mean, for my listeners here, they talk a lot, in load and size and this and that. Is that what would require an ejaculate or would cause an ejaculation that's not reaching, distances, so to speak, as what it was when you were 22 years old?
That's more of a muscular thing in back up inside, more
Yeah.
of a muscular issue. Um, Great exercise for that is Kegels.
Yeah.
Women do it all the time. Men don't think they should.
Yeah.
Well, yeah, that helps a lot.
Okay. So, what does it look like from a patient's perspective? You're doing these treatments in office in Colleyville and Frisco, right?
In Colleyville now, we closed Frisco down.
Okay.
I'll explain that too. But
So, patient shows up day one. What do? You checking hormone levels first? What are you doing?
patient shows up, says, I want in. What do? We draw blood first thing out of the gate. And then we take them back and they get their first shockwave and laser treatment right then and there. 1 week later, they come back and we adjust their hormones at that point. We have a full blood panel that we run. We know exactly where they're at. We don't chase numbers with hormones. We know what a range you're supposed to be at based on science has given us a pretty good thing. And there's a new thing I'm pretty excited about too. Little throw out there for a company called the DNA Company, amazing company. I don't know if you've heard of them or not. Tracy Wood is the CEO. She's an amazing woman. But the DNA Company has a blood test that breaks down your DNA of how different drugs your body will absorb or not absorb different drugs, how your body will absorb different types of foods and not absorb it, all based on your DNA. Also can break down through your DNA exactly what your optimal testosterone level should be through your DNA, what your DNA wants.
Yeah.
Pretty powerful. Expensive, but it's pretty powerful. So we just started offering that to patients that's above and beyond the Regen Max cost. But if you want to know specifically, you can pay this extra, I think it's $600 or something, and you'll have a full DNA breakdown of exactly what your body needs, doesn't need, absorb, won't absorb, use, and not use.
Yeah.
It's pretty powerful. But anyway, we know pretty much where you need to be based on our experience and science of where you kind of a zone. But then it comes down to, okay, what's your sleep like? How you feeling? Brain fog. We ask a lot of questions.
Yeah.
And then we can really get you dialed into the right area to where, okay, this zone is where we're going to keep you at because this is where your prime is. More than likely, that's where you were at your optimal stage in your 20s, in your prime. So we will take care of that on their second treatment. And that's also when they get the he shot, which is the tissue regenerative fluid. Come back in 1 week later, shockwave and laser. After that, it's every other week. After about 6-8 treatments, you're doing good. You're waking up with erections. Things are happening. The Regen Max program is a year, but that doesn't take a year for you to get the results.
Right. A year of every other week.
Yeah, but there's breaks in there because it's just like, again, lifting weights. You have to recover.
Mm-hmm.
We have to let your body go through the regeneration process and some rest and downtime. There is no downtime to this treatment at all. So when you're getting these treatments done, we want you to use it. The more you use it, the better it is, right? So we want you to use it. But, 6-8 treatments and you're doing well, we'll give you 4 weeks off, no treatments. Come back, we ask a bunch of questions, we start up again. 6-8 times, 4 weeks off, do it again.
Yeah.
The reason why we run it for a year is our studies showed that anybody that finished the year, we don't see them again, except for their hormones.
Yeah.
They're good. They're good and they're happy and they go on about their life and they don't have to take pills. They don't have to worry about any of this stuff.
If you come in, you finish the year, you're continuing the optimization of the hormones. How long, on average, would the year that you spent be effective?
Hard to say. Everybody's different. I got patients that are now 7 years since the study was done, 7 years into this.
Mm-hmm.
They're great.
Yeah.
Haven't seen hide nor hair.
Yeah.
Having said that, it really comes down to if you just take general good care of yourself, just general. You don't have to be like a gym rat and you don't have to be like the Yule Gibbons and eat all this perfect diet, but cut out your sugar, just eat healthy, general healthy. And we even have a maintenance program where we do 4 treatments a year. You don't even have to do that, but those who do it, they're totally fine.
Yeah.
It could last 10, 12 years, but it is going to degenerate.
Yeah. But slower if you're continuing to optimize
That's
the
the
hormones.
key. If you stay active, keep your body moving. A body in motion stays in motion.
Yeah.
Keep moving, keep your hormones right. This is going to last a long time.
Yeah.
Long time.
And so if you're in Colleyville now, what does your setup look like? I've used one of the home shockwave therapy devices. It
None of
feels
the power.
right. So that's what I'm getting at. This sounded like a jackhammer. It was pretty crazy. It was intimidating. No pain, but intimidating. Um, how do you scale that business? How do you reach more patients?
I just love your questions. What we do is we got issued the only patent for the cure of erectile dysfunction. Don't take my word for it. Look it up. There's not another one out there. And the original business model, we had Frisco, we opened Colleyville. We were literally within a month, 3 weeks to a month away from signing a lease and opening another one in Florida. It takes $500,000 to open up a clinic. And the original business model was we're going to open 5 clinics around the country and then sell the whole thing as a franchise type model, doing the RegenMax protocol. Then finally, after several years of fighting back and forth, finally in November of 23, the patent got issued. Was absolutely ecstatic about that and threw on the brakes and said, stop. Let's license the patent to existing providers that have a patient base already. Family practice docs, internal medicine docs, functional medicine docs. Those guys, they see ED before anybody.
Yeah.
Right? They just don't have a way to treat it other than Viagra and Cialis. So, or urologists will say, well, let's do a penile implant. Nobody wants that either. But so we put a license out for you, buy a license to operate this protocol. We teach you, support you, give you marketing support. We do all kinds of stuff in that. And that's the goal. And we just launched that a few months back. We've got 10 or 12 licensees right now, and we've got a small team, but a team that is working away at calling doctors and trying to get this out into their hands. The more we can get, the better off it is, because we can help a whole lot more people. This really isn't something. Number one, the laser's $200,000.
Yeah.
So it's not a home device, and you couldn't even buy the laser unless you're a doctor. So
that was my next question: is what kind of space? Any of the doctors that are listening here, do they need an open exam room? Do they need $500,000? What do they need?
No, if you have a patient base and you're already operating, you're almost home. There's 2 different options. We have 2 different pieces of equipment that you're going to be anywhere from $150,000 to $200,000. All in for a doctor who has nothing to be able to do RegenMax on a full-time basis and offer this out. All in, you're about $250 to get in. That's not paying me $250. That's if you don't have anything, and we're just getting you hooked up.
Who operates the equipment? Doctor, nurse?
Depends what state you're in. In Texas, pretty lenient there. You just have to go through what's called a certified laser technician school. It's a state-run thing. The shockwave, anybody can run that. None of this has to be done by the physician. Physician needs to oversee it. And I will tell you this, I have a doctor that works for me. Patients love to hear from the doctor.
Oh, yeah.
It's not just, just getting the treatments. They'd love to hear the conversation. So it's not labor intensive really at all. But I will tell you this, the average clinic does 5 a month. New patients is a month. Think about that.
Yeah.
$50,000 of revenue that you didn't have before. So in essence, what I'm telling you is, you give me $250, I give you back $500,000 to $600,000 a year.
Yeah.
In revenue. We've got performers, we've got studies on offices that are running it, case studies. The numbers are there. And my goal is, obviously, I want to get this out as many hands as I can. I would love to be honest, I would love to sell it. I would love to sell the patent and the concept. We've proven proof of concept. I would love to sell it to somebody who's got a lot more money than I do, and the ability to take by storm.
Right.
You know, I'm sure you've heard by now of the franchise model out there called Game Day.
Mm-hmm. Oh yeah.
They just started a
Yeah.
year ago.
Really?
Yeah.
Yeah, they're a marketing machine.
A marketing machine with millions and millions and millions of dollars, tens of millions of dollars behind them.
Yeah.
And they came out of nowhere. And I actually went and sat down with the CEO face to face, and he was the most pompous ass I've ever met in my life. But he really was. He was like, well, "There's no way there's a patent on curing ED, or I would have known about it." Okay, you can think that, but here it is. What do you want to do about it? You know? And he said, "Well, we're too far into our business model to add this. They're paying. It costs $600,000 to buy a game day franchise.
Yeah.
Where you don't have a patient base, by the way.
Right.
You just buy that."
Yep.
And I said, "Well, let me ask you this: what makes you different? Because what you're doing, your tool bag to fix ED, is what everybody else is doing."
Yeah. And that's a problem.
It's a problem,
Patients feel like cattle being run through clinics like that.
right?
They don't like it.
And I said, "So what sets you apart from everybody else? You got a red door and a cool logo. Is that it? What makes you different?"
Yeah.
And I have a lot of game day owners, franchise owners that are calling, asking, "Can we do this?"
Are they allowed?
No.
No.
I said, "I can't do it. I would if you open up at a clinic next door, we can do that.
Yeah.
But I can't." I mean, I've been told straight up by the CEO, "No, we can't." They paid 600,000. Now they're looking to spend another 250,
Yeah.
200, 250, roughly, to get in it. And they still don't have any patients. These guys are losing their butts like crazy.
Yeah.
But if you, John Doe citizen, looks it up online, you think it's the greatest thing in the world. I did.
Yeah.
That's why I dropped everything and bought a ticket and flew out to Southern California and went and wanted to meet the CEO. I'm like, this thing's humongous. It's not.
Yeah.
But that's not how it looks.
How many locations do they have? Do you know?
Well, there's on the books right now is 400 and something, but there's only 100 open. But over the next 12 months, they'll have all 400 open.
Mm.
And then now they're launching Her Way, a female version of it.
Yeah.
And I really think they're doing that because they're spending a lot of money, and so they're launching it earlier, like a year and a half earlier than they were planning on.
Yeah.
So anyway, I totally digressed on that, but I said all that to say that I would love for a company to buy this from me that could actually take it by storm like Game Day did,
Yeah.
and actually have a real cure.
Right.
It would be amazing.
So who do you talk to in that case? You looking for venture capitalists and things?
Sure.
Like that?
I'll talk to VCs. I'll talk to private equity. Doctors want to. I know there's doctor groups out there, hospital groups out there.
It's hard to find a doctor group that's business savvy.
You know what? You're so right in that. Most doctors do not have the business acumen.
That's what, when you're talking about licensing to existing practices, my first thought was, but how hard do you have to work to find a doctor that's like, aha, that's a great idea, let's do it?
It's not what I thought it would be.
Yeah.
I really thought the same way. I've dealt with doctors for years, and I really thought the same way. But I will tell you that there are really great doctors that are getting away from the write a script for everything.
Yeah. And
that is becoming medicine. Thank God it's changing, because I'm so tired of the white pill for this, the blue pill for that, the red pill, all these pills, right? And people are starting to realize that there is a natural way and there's a healthy way to fix the problem instead of treat symptoms, which is what Western medicine has done. And so there's a lot of doctors. I mean, I could think of a doctor right now, family practice, great guy in North Carolina. Amazing doctor. I told my wife, if I ever had cancer, that's the guy I want to tell me I got it.
Yeah.
Because he's that kind of doctor. Like, patients love him. He saw this in a 15-minute conversation. He was like, I see ED all day, every day.
Yeah.
And he said, I didn't know what to do with it. Showed him the studies. We went through the numbers. He's like, I'm in. What do we do? I just saw him a couple weeks ago, 2-3 weeks ago, was in North Carolina and met with him, did an event for him. And it's great. He gets it and he's loving it. And he was off to the races. His first week, he made 30 grand.
Yeah.
His first week.
Yeah.
So
how do you get the news out there? Are you traveling the country meeting with doctors? Do you have an affiliate program?
I have, well, we do. We have some affiliates. We're trying to get more. Um, but we have I have a guy, a marketing guy, my director of licensing, and we do conferences and we do the old school dial for dollars and getting them on the phone. AI has really helped a lot.
Yeah.
AI has really helped a lot. I signed up with an AI program that has brought us a ton of real qualified, exactly what I'm looking for doctors to do this. Because I don't want a plastic surgeon doing this. I don't want a med spa doing this.
Yeah.
I honestly, not even a urologist. I used to educate urologists on this, and I quit because all they want to do is argue with me. And I'm like, listen, I'm not here to argue. I'm here to present a thesis, present what I've proven to be fact. By the way, we're over 3,000 patients have gone through this, and a 250 patient study with 97.2% success. Over 3,000 have gone through it. We're still there, 97.2. So the numbers have not changed,
Yeah.
which is great. I love that. But
Why no med spa then? If you're
because would you go to a med spa to get your penis fixed?
I probably wouldn't go to med spa period.
Exactly.
But
it's a very difficult conversation anyway.
Yeah.
So a lot of people say, why'd you name your clinic Sexual Wellness Centers? Because there's no mistake of why you're going there.
Yeah.
I mean, if you are there, you're there because you got an issue.
Yeah. I mean, that's like I saw a donut shop called Donuts Near Me. I mean, I'm all for that type of marketing.
Yeah, exactly.
So the name of your shop is Donuts Near Me. I'm Googling Donuts Near Me. Got it. Yeah.
I love it.
I like the black and white.
I love it. And so it almost gave people permission to have the conversation. And again, it's a very sensitive topic, man. Back to our original starting conversation here was how hard it is on your mind and your emotions and intellect, all that. It's terrible. So when you plug that in, when they sit down at our table and we have a conversation, it's just, they can't tell us something we haven't heard, number one.
Yeah.
No, we're not shocked at anything. And it gives them permission to just finally dump their bucket and say, man, this is what I'm struggling with. Mm-hmm. And it's great, man. I love it. That's my favorite part of it.
Yeah.
To be able to say, listen, I know exactly what you're feeling. I was there.
Yeah.
And I'm here to tell you there's light at the end of the tunnel. That's not an oncoming train. You'll be fine.
All I can think at this point is my good friend Ian. He's been on the show dozens of times, but he struggles with it. And then he struggles with the ED, but then the emotional, the mental, and it's like this circular issue where, emotionally, no erection, even worse, and it just repeats itself. Once it happens once, it's almost for him, it's like you're never getting a hard on again because
it's so true.
It's mind fucking him, and all I can think is he's in Grapevine. He needs to come see you.
Hey, he's 2 minutes away.
Yeah.
I will tell you, listen, honest to God, what you just said is so accurate. When a man has one issue one time, mm-hmm. that it might not even be ED. The clinical term of right. ED. It might be stress, had a hard day at work. Mm-hmm. It might be too much alcohol. It might be completely checked out for any number of reasons. Doesn't matter. In his mind, I failed to perform. I let her down. I failed to perform. Oh my God.
Yeah.
And now guess what happens next time? What if?
Yeah.
What if?
And then because you're thinking,
you've checked out.
Yeah.
And then it's over.
Well, where can we find out more? Where can patients visit you? Where can a venture capitalist come swoop this company up?
Man, you have no idea how much I would love that. Not because I want out. I want to stay on board.
Yeah.
I'm on a limited budget of how fast I can scale this up, mm-hmm. And if I had the money behind this, I could blow this thing up. I have the plan. I have the model. I know what we've got to do. And we could literally take ED by storm, coast to coast, border to border.
Yeah.
Quite easy. We have a saying at the office, we make hard easy. So
nice.
But so regenmax.com, regenmax.com. That's really the RegenMax site for people who are interested and want to become a licensee. But we've had a lot of patients that we've gotten through that site too. So anybody can go there. It's not limited.
Yeah.
And then our clinics for sexual wellness centers, swcusa.com. And all the information you want to know is on both those sites. You can always call us. Our phone numbers are there. But we'd love to talk to anybody about fixing them or taking this to a whole nother level.
Yeah. How many states are you operating in right now with all of your licensees?
6.
6. Okay.
6 states.
Name them. Texas.
We have Washington State, North Carolina, Illinois, Florida, Texas, and Nebraska.
I bet you're killing it in Florida. There's
They just started killing it. We had to help them out.
Yeah.
They were med spa oriented,
Yeah.
and we had to get them into clinic oriented. And so much so that they bought 2 licenses.
Why?
Because they bought a license for their clinic in Claremont. And then when I told them I was about to open up an office in the Villages, they bought a license in the Villages.
Okay.
And so, which is great because I didn't have time to go do it, but and couldn't be a better spot for them. You know, the Villages is the STD capital of America, and every guy there is struggling.
Yeah.
Period.
This is really cool. I'm going to talk to Ian about coming to see you, and hopefully we can find somebody that'll help financially and get this thing really going.
I would love that, but I want to joint venture partner with you anyway. I've been listening to your podcast and understanding what you're doing, and you got a lot going on. I mean, you got a lot of connections all around what we're doing.
Yeah.
I mean, first of all, all things testosterone is
all encompassing.
That's what starts it,
right?
And people don't get that.
Yeah.
And in a perfect world, we could test everybody at 20 years old.
Yeah. Get a baseline there.
Get a baseline.
It'd be nice.
Because then when you're out of that baseline, we can treat that.
Mm-hmm.
And don't mean we have to do TRT or anything, but there's some great supplements out there that will help you produce as long as possible.
Yeah.
You're still going to shut down. But there's some great supplements that are really, really, really good. And there's some BS supplements too that are just about money. But if we can get every 20-year-old to go test, gosh.
Yeah.
We had a 24-year-old college athlete, D1 college athlete, 420 testosterone level.
Yeah.
It's happening younger and younger and younger.
I think you got to start with the doctors.
Oh, yeah. We got to educate them. But the problem is they know everything.
Right.
They know everything. So you can't tell them anything.
Yeah.
And then they go to a weekend conference, and what they hear, instead of learning how the hormones affect the entire body, what they hear is, that's another cash situation. There's another revenue stream that I can put in my office. They do a weekend course. They think they know it all. They go do what they learned in that weekend course. And man, I get patients all the time that are so screwed up.
Yeah. Probably because they're implanting pellets. You don't implant pellets, do you?
I absolutely implant pellets. And there's a way to do that, and there's a way not to do that.
Yeah.
And there's a whole lot about that.
What's your number one go-to administration method? Is it pellets?
Yes, but I'm working on a new one. And I've got a provisional patent. I can discuss it. It's a provisional patent already issued on it. And it's a design of a wearable that you wear when you sleep. When we sleep, that's when our body distributes hormones.
Yeah.
Okay. So that's why they say test your testosterone in the morning. Naturally, that's when you're going to get your best reading.
Mm-hmm.
Then whatever you use that day, it's lower, right? So in my brainstorming, I'm like, all right, I'm all about bioidentical because I don't like synthetic hormones at all. I don't like the repercussions from them. So what can I do? I got to come up with a bioidentical delivery system that delivers a bioidentical drug. So I've created a bioidentical liquid testosterone.
Okay.
It's cholesterol based. That's bioidentical. And we'll go through a 31 gauge needle. So it's not real thick.
Wearable on the penis?
Nope. So then I created a pump that's the size of a silver dollar.
Okay.
You get 30 days issued by your pharmacist a month. You get 30 cartridges issued to you. You put that cartridge on that device, turns and locks. Before you go to bed, you stick it on your arm, your stomach, your butt, wherever you have some fat. Stick it on there, and it activates the pump. In over 6 hours, it will deliver your testosterone level.
I think that's genius. It's like the CGMs that everyone's wearing anyway. You put it on the other arm. You know, you've got your
It's non-invasive. You're sleeping. Nobody cares. So you don't want your girlfriend to know you're doing it, whatever. Right? She ain't going to care anyway. But it's something you can do. You don't have to do shot once a week or twice a week, however you're doing it. You don't have to go get pelleted. You don't have to do anything. Stick it on your dang arm. Go to bed. Take it off in the morning. Put the pump on the charger. Throw the cartridge away. Go
so
to
you
work.
do put it on every day,
Every day for
and
you.
then overnight it's going through.
You put it on just before you go to bed.
You said liquid. I'm assuming this isn't a traditional, like, you know,
Grapeseed oil, cotton. It's not
Cypionate.
Depo.
Yeah.
It's
What do
not
you- what do you-
Cypionate. No, that's the problem that I have with injectable testosterone. Your body has to break down the cottonseed oil, the grapeseed oil, to get to the testosterone molecule.
inflammatory, by the way. Yeah.
Exactly. So all the health problems all the horror stories you read online about testosterone, it's all tied to Cypionate or Depo or something like that. And more, and in all fairness, it's more tied to the black market testosterone. Like that stuff is horrible.
Yeah.
That stuff is, you're injecting a death sentence. In my mind, you're injecting. Lyle Alzado would have told you that if he was still alive. I mean, there's a lot of guys, that.
So what's the liquid? What is it?
Well, I can only tell you because it's cholesterol based.
Yeah.
And it's plant based, but it is rated as bioidentical.
Okay. So you developed the administration method, not so much the actual.
No, I did the drug too.
Oh, okay.
Yeah, well, in conjunction with a pharmacy.
Yeah.
A compounding pharmacy.
Okay. Yeah, I think. What are you doing with that?
Trying to raise money. I'm at a point now where there's a lot of interest. I'm out of money as far as taking it to next level. I got to build prototypes and put it out to 10 offices to test it for a year. And then
That's a lot of prototypes.
we'll get FDA clearance. At that point, we'll get FDA clearance approval on the drug. The biggest reason why the FDA won't approve hormone replacement is because there's no way to level them. Basically, there's no way to pellets. You stick them in 3-4 months. Whatever is there, you're stuck. Injectable, it's all over the board. Why is it? No one can answer this question for me. A guy that's 5'8", 150 pounds, 160 pounds, gets the same dose as a 6'6", 300-pound guy.
Yeah.
Why? Makes no sense. Zero.
Well, so how do you adjust the dose with this?
Great question.
Is it the disc or remote?
The disc that you attach to the pump will be your personal dosing.
Yeah.
Because everybody's different.
Yeah, and that kind of eliminates, a lot of the FDA issues with, you're just prescribing 3 months of testosterone at one time, and you're expecting your patients to be honest.
Exactly right. You're giving them 30 days, and they have to come back every 30 days.
Yeah.
And I don't know what kind of regulations FDA will put. Maybe they say have to have a blood test every 30 days. I don't know. I doubt it, but who knows what they do when they do it. But the bottom line is, the great thing is your testosterone will never change.
Yeah.
You'll finally be level. It will start off with one injection on day one. That gets your level up there. And then every day you're only replacing what you used.
Yeah.
Every day.
Is it possible to make that device wearable for 30 days without removing it and just
I don't think so.
release a little bit? No.
I don't think so, because it is a 31 gauge needle that's going into subcutaneous fat.
What's the difference between that and the CGMs?
Those are still changed. I would be afraid of infection. I would be afraid of a lot of.
But not every day they're not changed, right? Wear them for a week or two at least.
I think you can wear. I think the longest right now is 5 days or 6 days.
Yeah. So maybe it's the fact that those. I mean, you take one of those off and it looks like a little ribbon in there. Almost. It's not a 31 gauge needle.
Right.
So maybe that would play a factor.
But you are puncturing going about 3/16 in.
Yeah.
So
if you could get that to where you could wear that for more than one day, I mean, that would be. I don't like needles. I don't want to inject myself.
But what's wrong with just putting it on before you go to bed? You brush your teeth.
Nothing's wrong with it. But if I could do it twice a month, once a week.
But then would swimming be a problem? Would
people swim with the CGMs, don't they?
Yeah, I don't know. Great questions. Great great thing to travel down that road.
I would think that you should be able to design something that would just not impact life, other than don't trade licks with your brother. Like
Yeah.
other than that, you
Right.
should be good.
Right. We are patent pending on it right now, and they're awaiting my final. So we're protected anyway, but
Yeah.
we're awaiting the final studies so I can put the argument in the patent and say this is what you got to do.
Yeah,
And just for figures, let's say you burn 12 units a day of testosterone. Well, that's what your discs would be. Each one would have 12 units,
yeah,
right? And because that's what and it's figuring out your metabolic rate
yeah.
and how you're metabolizing that.
And it's as simple as here's more discs for next month because we were a little low here. That's my only hang up with pellets is once they're in, what do you do?
Yeah, well, we monitor very heavily at our office. I mean, we draw a lot of blood because, and I'm not, well, I am proud of this, but it's not something I look forward to. But we've uncovered several cases of prostate cancer because we draw blood so much. Where no, I'm healthy, I'm in great shape, I got no issues. No, we got a problem.
Yeah.
And so we're very careful on how we monitor that. And our hormone protocol is different. I don't know of very many people that do their hormones the way we do them. We don't allow you to get back below 600 ever again.
Yeah.
Ever again. Where most clinics, either want you to they want you to bottom out.
Yeah.
And then start again.
Yeah.
Or they just put you on this. We book you 4 months out, and then you do it 4 months out, do it again, whatever it is. And maybe you had a real stressful month in there, and you metabolized them. Maybe you didn't, and you've got a bunch of residual left from last pelleting. Now you're just putting pellets on top of that.
Yeah.
And now you're running 15, 1600, wondering why you're pissed off because somebody drove by you.
Right.
So you got to monitor that. And the lesser of all the evils of testosterone replacement, in my mind, are pure bioidentical pellets done properly. Again, am I against it? No, I'm not, because I know my body, and I will tell you, I'm honest about it. When my testosterone, I know my body well, and I know when my pellets are starting to run out, and I'm like, you know what? I've stacked too many times, meaning I've had residual.
Mm-hmm.
I'm going to let these run out. I will go to shots for a month.
Yeah.
Just to keep me good, and let those pellets wear out. And then I'll take a baseline and we go again. And that's just because I'm there and I can monitor myself, right? But so I'm not against it. I am against living on it.
Yeah.
My son, 34 years old, put him on testosterone, and he's a Fort Benning. So, I had to put him on injectable. He can't come to the office every 4 months.
Yeah.
But when he came out for Christmas, we pelleted him to get off it for a while.
Yeah.
Because I don't want you on that all the time. It is inflammatory. There are repercussions from it. People that are on it for several years, and actually a great way to do pelleting, run it for 2 years and then do injectable for 1 year,
Mm-hmm.
and then go back to pelleting and making that break. It's a great way. So I'm not against saying it's bad, bad, bad. I'm saying bioidentical pellets are the most trustworthy and the safest and the lesser of evils.
I can't focus on anything except for a disc in my arm at this point.
Yeah, well, let's do it.
That's what I want.
Let's do it. Maybe the same private equity. Maybe we can roll it up.
Yeah. Yeah.
And put it all in one company.
Yeah.
And let's go. I'm all in.
Well, again, I appreciate y'all coming out, Dr. Nuziard. I'm going to connect Ian with you. I'm going to put some brain power behind the roll up and the contacts I have. But yeah, appreciate it.
Thank you so much for your time, and thank you for having me on.
Yeah.
I followed your podcast. I love your guests. I think it's great.
Cool.